I think it's almost indispensable. Everybody's using social media. What happened was, at our Federation of State Medical Boards, we were approached by some researchers to do a study to see if physicians were utilizing social media, but also to see if physicians were getting in trouble, if they were using it the wrong way. We knew there were some studies looking at medical students, so we said, sure, let's look at this. Surely physicians who are licensed and have been practicing for a number of years would know better and are just better at managing this. What we found was a little bit shocking. We found the majority of state medical boards have actually disciplined doctors who have used social media the wrong way. So while social media is a great way to connect with patients and the public, we were a little alarmed that sometimes it can be used the wrong way. And I'll give you 3 quick examples of how social media can be used wrongly by physicians. And this is based upon the data which was published in JAMA, Journal of the American Medical Association, not too long ago. One is physicians claiming a credential they don't have. Another is promising a cure. That's a no-no. We don't do that in medicine, as you know. And third was engaging in the type of communications with a patient that you probably shouldn't, like asking them, inappropriate questions or asking them out on a date. This became cause for concern among the state licensing boards. So what we did was we partnered with the American College of Physicians, which, as you may know, is one of the largest specialty organizations in the United States, has more than 120,000 members, and we put together a policy statement. It was published in April of this year in Annals of Internal Medicine and has gotten quite a lot of play. And all it is giving recommendations. We embrace technology, we welcome technology, but the state licensing boards and the ACP felt that it was a good opportunity to remind physicians about how to stay out of trouble. And 2 basic principles of that policy. 1, pause before you send. So you may, in the heat of the moment, put something together in a tweet or even in a LinkedIn comment. So think about, before you press send. We're not saying don't press send, but just make sure that that's what you want to be out there for perpetuity. And second, it might be worthwhile as a recommendation to keep your personal profile separate from your professional profile. Once you start to blur the line, our data show is when things get a little tricky and you could set yourself up to get in trouble. And so that's why I have a Facebook presence, but that's personal. I don't have that many friends on my Facebook site, but it's for my family and close friends. My organization has a Facebook presence, and that's what I use for professional communications, but that's part of that, to try to be consistent with that as well. Probably LinkedIn is the easiest because there's not much I have to do periodically, but Twitter was perhaps a bit challenging. In my previous life, I was a health commissioner, and I found sharing information through tweets very useful, especially as we were dealing with the H1N1 influenza situation. So in my current job, I was a little hesitant because I felt that as a public figure, especially in the role that I had, maybe I didn't want to have something out there for everyone to look at and comment forever. But my staff encouraged me, and actually I think I now have 400 tweets out there over the last year or 2, and I like it, I enjoy it. I'm very careful. I pause before I send, and what I'll do is, I won't say things like what I had for dinner, but if I had a great dinner, I'll certainly mention that. But the focus is really to try to share some of the great articles I see on the web about healthcare, about patient protection, and making sure that people who are following me, who I assume like to follow me because they get access to that, that they continue to follow me. I haven't had too many people unfollow me, if that's the term, but I don't have thousands of followers either. So it's something that I've embraced, and I hope other physicians will too, as long as they pause before they send. Good question. I'm not sure. I think just networking of any kind is always beneficial. LinkedIn obviously provides a great way in which to share your professional background, something you can't really do on Twitter as much. At the same time, I think just meeting people at meetings like this is a great opportunity. Nothing beats face-to-face type of networking. So technology is there to supplement it, but ultimately it's got to be one-on-one. Telephone, email are still there.
Great. We look forward to what you have to say with the conference.
Thanks very much.